So good evening, everyone. My name is Abby Beho. I am the program director at Lake Health and Wellbeing, and we're a public health NGO based here in St. Kitts and Nevis. And we aim to improve the health and well-being of our local, regional, and online community through public health interventions, through events like these, through research, and through campaigning. So it really is a pleasure for us to be here today. I want to say big thank you to the Bar Association for allowing us this opportunity and for collaborating with us to host this webinar on the role of law in public health policy. So I guess I just want to start off by just quickly introducing the session and the aims of the session. And so this webinar really aims to explore the role that lawyers and the law play in the prevention and control of non-communicable diseases by supporting the development of effective development of public health policy. Now, a lot of times people don't necessarily see the connection between public health and law, so that we hope that today we'll be able to make that connection very clear, because there is a very important role for lawyers in the development of public health policy. So today we'll be using tobacco control and sugar-sweetened beverages as examples in order to explore that important role that you play as lawyers in public health policy by ensuring that not only are policies effective at tackling non-communicable diseases, but by ensuring policies are fair, equitable, and respect human rights. So we have two very fantastic speakers for you today. So just to tell you a bit about the structure for the session. So we'll have some welcome remarks from your president, Mr. Garth Wilkin, president of the Bar Association. And then we'll have our first speaker, who's Dr. Marissa Carty, who is the NCD program coordinator for the Ministry of Health here at St. Kitts and Nevis. And Dr. Carty will talk about NCDs and the law and explore basically the work that the Ministry of Health is doing to develop particular public health policies, and with a focus on tobacco control and SSBs. And she'll also explore how lawyers can support the work that the Ministry of Health is doing in terms of developing these policies. We'll then hear from Nicole Foster, who is the Deputy Dean and Head of the Law and Health Research Unit at the Faculty of Law, the Cave Hill campus at the University of the West Indies. And Nicole will talk to us about the role of law in public health policy, focusing on local and regional legal considerations for tobacco control and sugar-sweetened beverages. And then we'll have a discussion and Q&A session where you can ask both speakers any questions that you may have, raise any concerns that you may have about the topic. And this will be led by Iceline Phillip, who is our Advocacy and Research Officer at Lake Health and Wellbeing. And then we will close off with a vote of thanks and closing remarks by Rhonda Nisbett-Browne, who's a member of the Bar Association. So just quickly, a few little housekeeping things. Everybody is on mute and your cameras are off. This is really just to prevent any disruptions while the speakers are giving their presentations. So if you have any questions, comments, you can put them in the chat box, and then we'll get to those questions and comments during the Q&A session. If during the Q&A session you actually want to speak, then you can raise your hand and then we can unmute you so that you can actually speak and put forward your question or your comment. So without further ado, I'm going to hand over to Mr. Wilkin to provide some opening remarks.
Thank you, Abby.
You're welcome.
On behalf of the St. Kitts and Nevis Bar Association, I welcome all who have tuned into this continuing legal education session discussing the role of public law in public health policy. One of our statutory mandates is to promote and report on legislation in St. Kitts and Nevis and to promote and support desirable measures of law reform. It is therefore pleasing for our Bar Association to collaborate with the University of the West Indies, the Ministry of Health, and Lake Health and Wellbeing to promote this CLE seminar on such a timely topic, as we focus on living healthy lifestyles which can limit the human impact of this and future epidemics and pandemics. We have learned over the past 2 years that our health decisions have consequences, but what role should the state play in such decisions? How far should they go? How far can they go? These and other questions have revolved around vaccination in recent times, but there are other long-term public health issues that will persist even after this pandemic subsides. The topic today and its focus on tobacco control and sugar-sweetened beverage policies therefore should resonate with all of us. It really is time for such debates to reach the mainstream, and we are pleased to help in highlighting these topics for public discussion. Like all of you, the Bar looks forward to hearing what these learned presenters have to say generally and particularly with respect to finding the sweet spot, no pun intended, where laws can assist in improving public health and making our societies more resilient to the inevitable public health challenges to come. Welcome. Back over to you, Abby.
Wonderful. Thank you so much. Thank you. Really appreciate those remarks. So really, I'm not going to waste any time. So I'm going to hand it over to Dr. Marissa Carty, who is the Non-Communicable Disease Program Coordinator at the Ministry of Health. And she will talk through the work that they're doing in terms of developing those policies around tobacco control and sugar-sweetened beverages. So over to you, Dr. Carty.
Thank you so much, Abby. And I just want to say thank you and to the Lake Health and Wellbeing for inviting me to speak at this webinar this evening. A pleasant good afternoon to everyone. I'll quickly just jump into the presentation. This shall allow me to share my screen. This evening, I'll be sharing information pertaining to NCDs and the various policies, well, two main policies that we are currently developing here in country, specifically the tobacco control policy, as well as the sugar sweetened beverage policy. The growing burden of NCDs globally has encouraged lots of research looking to cost-effective interventions that would empower persons to adopt healthy behaviors. One effective intervention is the use of law through policies and legislation to encourage these healthy behaviors. So today I will be sharing some information on the NCD situation in country and the policies that we are currently developing. Now, just for some background, non-communicable diseases are medical conditions which are not infectious and they cannot be passed on from one person to another. They are usually chronic and tend to be of long duration. And as a result, and maybe as a result of a combination of genetic and psychological, environmental, or behavioral factors. Now, in recent years, mental illness has been added to the long list of the different types of NCDs. However, the WHO focuses mainly on these four NCDs: cardiovascular diseases, cancers, diabetes and metabolic diseases, and chronic respiratory diseases. What they have found is that persons diagnosed with mental illness, the risk factors for NCDs tend to contribute also to mental illness. And that is one of the reasons why it is now added as one of the main NCDs. Now, NCDs are no respecter of persons. They can affect persons in any age group, any class, region, or country. All persons can be affected by NCDs. Now, NCDs are known to develop due to what we refer to as risk factors. Now, risk factors are conditions or behaviors that increases one's susceptibility to developing a chronic illness. And these risk factors can either be non-modifiable, meaning that you can't do anything about them. And some non-modifiable risk factors are like our age, for example. So the older we get, the more susceptible we are, or the more at risk we are of developing a non-communicable disease. Our sex, male or female. There are some conditions that affect males or females more readily than the other. And then because of our genetics, so we find that there are some conditions that have a hereditary trait. We also have what we refer to as the modifiable risk factors. So these are factors that are based on behavior, things that we can actually do something about. So these include four main shared risk factors, which are tobacco use, physical inactivity, unhealthy diet, and the harmful use of alcohol. Now, in the Federation, non-communicable diseases are the leading cause of death. Between 2015 and 2019, we've actually seen a rise in the number of deaths attributed to non-communicable diseases. In 2015, the percentage was about 52.2%, while in 2019, it is about 68%. So we see that there is a trend, there's an increase in the number of deaths attributed to non-communicable diseases. Now, there are three main causes of NCD deaths in the Federation: cardiovascular disease, cancer, and diabetes complications. Additionally, another trend that we see is the number of amputations being reported at the General France Hospital. Now, we do know that amputations can be as a result of motor vehicular accidents or occupational accidents as well. But what we've realized is that the majority of amputations being done at the hospital are as a result of diabetic complications. Another trend for our adults is the percentage of adults within our federation that is overweight or obese, and this is at 70%. Now, the risk factors for NCDs do not just only affect our adults, but they also affect our children. Unfortunately, we haven't done another global school health survey since 2011. However, based on that survey, 32.5% of our children, and this was done with children between the ages of 13 and 15, were overweight, while 14.4% were considered obese. Now, from that same survey, 61.6% of those students drank a soft drink either one or more times per day within the last 30 days. And 25.6% of those students were found to be physically active. These numbers are quite alarming. And then we also had the Global Youth Tobacco Survey that was done in 2020. And what that showed us was that 9.2% of our youth within the same age range they indicated that they were currently using tobacco or smoking cigarettes. So these were some of the data that we use in order to develop the policies that I'm going to be speaking about now. Now, the Ministry of Health utilizes three main methods to fight against the growing burden of NCDs. And these are program implementation, policy development, and legislation. The World Health Organization Global Action Plan for the Prevention and Control of Non-Communicable Diseases encourages countries to consider the use of economic tools that are justified by evidence, which is one of the reasons why we use the information from our situation analysis to be able to determine how to put our policies together. These may include taxes or subsidies to improve access to healthy dietary choices and create incentives for behaviors associated with improved health outcomes. Now, this evening, we're going to be focusing specifically on policy development and legislation. Now, for non-communicable diseases, there are three main policies that we have been working on developing. That is the first is the National Multi-Sectoral Plan for Prevention and Control of Non-Communicable Diseases. We actually had a 5-year plan that lasted from 2013 to 2017. That plan has since expired, and we are currently working on developing a new NCD plan. The challenges that we are having with the development of this plan is that we need to make sure that we have recent data or situation analysis in order to govern how we put this plan together. We are currently working on implementing our steps, which is the NCD risk factor survey that will help us with the development of this plan. The other two areas that we are looking at is the sugar sweetened beverage policy and the tobacco control legislation. So I'll begin with the tobacco control legislation. In St. Kitts and Nevis, the tobacco control legislation, and so by the time I got there, they were in the phase of actually developing the actual legislation. So I would believe that the public sensitization and key stakeholder engagement aspects of the development would have already been done. The legislation development began in 2018, and the WHO Framework Convention for Tobacco Control was used as a guide for developing the outline for the legislation. Now, in the legislation, these are the areas that we have concentrated on: protection from secondhand smoke, or more specifically, encouraging a 100% smoke-free environment, prohibition of sales, packaging and labeling, tobacco advertising, promotion and sponsorship, protection from industry influence. And I think this is the area where we would really need the support from our law partners, and then prevention and control of illicit trade. Now, please note that the legislation does not speak to tobacco tax. One of the reasons for this is that based on PAHO's guidance, the taxation should be a separate legislation from the rest of the comprehensive legislation. So that's one of the reasons why this Tobacco Control Act does not speak specifically to tobacco taxation. That is actually supposed to be a legislation separate and apart from, and we will be working towards that as well. Now, currently, the draft legislation was sent to PAHO for review. We did get back their feedback. And so what we are now in the process of doing is liaising with the legal department in order to ascertain a focal point who would then help us with the drafting instructions, which we would then submit to the legal office for the onward development of the legislation. We are hoping that this process could be completed by the last quarter of this year with a document that we would be able to submit to Cabinet. Now, as it pertains to sugar sweetened beverage policy development, this process was a little bit more in-depth. We started the process in 2017 with a consultation with our PAHO advisor, then Dr. Tomo Kanda, and Professor Lisa Powell from the University of Chicago. Professor Powell has been a long-time PAHO advisor in the area of sugar sweetened beverage policy development, and she was more than willing to lend her expertise to country in order to help us to develop our policy. And so the process started with a data collection in 2017. Now, what we did was we used a food observation survey. We went around to at least 31 different food stores of different types. So we had supermarkets, small shops, and we made 849 observations. We were looking for the different types of beverages sold in these establishments, as well as their prices. We also considered the price of waters, the different types of waters sold, and their prices as well. Data was also collected from the Customs and Excise Department to determine the overall income of SSBs and estimated tax revenue. Once all of this data collection was completed, then the data analysis and reporting was done by Dr. Lisa Powell and her team. And then in 2018, she was able to send back a report on that data analysis. Once that report was received in country, we formed the SSB Technical Committee in 2018. And using the report, we were able to have discussions on exactly what we wanted to be in our SSB policy. And these were the 4 things that we discussed as it pertains to that. So we looked at the tax type. We wanted to make sure we added a tax that would help to reduce the consumption of SSBs. There are 2 tax types. We have the specific tax, which places a tax on the physical amount of the beverage. And then you have the ad valorem tax, which places a tax on the price of the beverage. Now, the Pan American Health Organization has since explained to us in country that the best tax type for the sugar sweetened beverage should be the specific tax type, because that is the type that would get us the most response from the community. We also considered the tax base. Now, the tax base is the beverages that will be considered under the sugar sweetened beverage tax. These beverages should be calorically sweetened beverages, which means that these should be beverages where sugar was added to the beverage. So you would find then that in some cases, 100% fruit juice may be considered excluded from the tax base simply because these types of juices do not have sugar added. However, we have had some discussions that even though fruit juices do not have sugar added, because they have their own sugars, which are still considered free sugars, that some level of taxation should also be on the 100% fruit juices. We also made provisions for alternatives, so being able to identify what persons can drink apart from sugar sweetened beverages. And then we also looked at the tax revenue. How can the tax revenue be used to promote health as opposed to just simply going into the consolidated fund? So those were some of the 4 main areas that we considered in our sugar sweetened beverage policy. We then in 2018 had 2 in-country consultations, 2 town hall meetings, one in St. Kitts and one in Nevis. Our PAHO advisors were in country for these town hall meetings. And while they were in country, they also engaged with key stakeholders in order to discuss the report that Dr. Lisa Powell would have provided to country and to also gain their buy-in for the development of the sugar sweetened beverage policy. We also in 2019 conducted a number of focus group meetings. These focus group meetings were, these focus group meetings involved a number of stakeholders as well. We met with representatives from the Ministry of Education. We met with food handlers and agro-processors. We met with the Bureau of Standards. And we also met with distributors in country as well. During these meetings, we shared the findings of the SSB survey. We discussed the policy imperatives as it pertains to the SSB policy. And then we used that opportunity to gain commitment to ensure the successful development and implementation of the SSB policy. Once those consultations would have been completed, the feedback would have been compiled, and then we used that in order to come up with the first draft of the SSB policy. This draft was sent to the Office of the Permanent Secretary and CMO for review, and then we also sent it off to the Pan American Health Organization for review as well. It is currently at at the Pan American Health Organization, we have had a number of discussions with PAHO pertaining to the SSB policy, and we are hoping to have some more joint meetings with the Pan American Health Organization. And we have, based on the discussions we have had with them, we should be able to finish the completed draft, final draft of the SSB policy by June, which means that we will then be in a position to have a final stakeholder meeting and be ready for cabinet submission by September of this year. Now, these are the four main areas, four broad areas that we have listed in our SSB policy. Taxation of sugar sweetened beverages to foster reduced public consumption, restriction on the sale and consumption of SSBs in public or government institutions, such as hospitals and schools. We also have the engaging in public awareness campaigns to advocate for the restrictions against SSBs, and then recommendations for channeling the relevant tax revenues from SSBs to preventive and promotive health. And I would have explained our next steps already, but once PAHO is completed with the final draft, then we would be ready for the stakeholder consultation and submission to cabinet by September 2022. So then, how can the Bar Association support us as we continue along this policy development? One, we're suggesting considering adding public health law as a specialty. Public health law practitioners can work alongside public health officials as we develop our health policies. Now, like I said, yes, other health policies and other health legislations that we are encouraged to develop. And so having that support, having that focal point from either the Department of Legal or even from individuals who, from the Bar Association, might think that public health law is an area that you're interested in, can work along with the health officials in the Ministry of Health. You can support us in the drafting of health policies and legislations, and also in evaluating the efficacies of the health policies we are developing. Ultimately, becoming part of the team that supports and protects a person's right to health. We can also assist in public health legal research. Both the tobacco legislation and the SSB policy are interventions which complements the right to health. Unfortunately, these policies, they also affect large manufacturing and distribution companies, and they often employ, these companies often employ interference tactics. For example, you might find that they fund research studies which are usually biased in their findings, or they might bring legal action against the government to prevent the enactment of the policy or the legislation. Now, other countries have faced these legal challenges, and we can learn from their experiences. And so therefore, having legal minds who can help us with that type of research and being able to make sure that the laws that we develop do not have those loopholes that can allow these companies to take advantage of. And then finally, we must ensure that the policies that we develop are for the good of the people. Lawyers are in the best position to provide effective oversight of the health system. Now, doctors and lawyers are often at odds due to a number of reasons. Example, malpractice threats or medical regulations. However, lawyers and the law play an integral role in facilitating access to care. And so encouraging good governance is one of the ways in which you can support the Ministry of Health. by ensuring that the policies and the legislations are not open to the influence of corruption. And then finally, by advocating for equal access to care through the universal health coverage. So in conclusion, collaboration between lawyers and public health officials is essential to public health law development. Enabling a positive legal environment where lawyers and public health officials can collaborate is essential to reduce the burden of non-communicable diseases in St. Kitts and Nevis and to provide support to people affected by these conditions. Also, building capacity in public health law also affords this opportunity. By expanding partnerships between law, medicine, and other sectors, we can meet the urgent need to support resilient health systems for sustainable population health. And therefore, together, let us beat NCDs. Thank you so very much.
Wonderful. Thank you so much, Dr. Carty, for that very comprehensive overview of the work that the Ministry of Health is doing to develop public health policy. So we're going to save questions until the Q&A section. So we're going to move on to our next speaker. So thank you so much, Dr. Carty. So we're going to move on to our next speaker. And so that will be Nicole Foster, who is the Deputy Dean and Head of the Law and Health Research Unit, the Faculty of Law, Cave Hill Campus at the University of the West Indies. Mrs. Foster is going to talk to us about the role of law in public health policy, and she's going to give us a bit of an exploration or analysis of the local and regional legal considerations for tobacco control and SSB policies. So over to you.
Thanks so much, Abby, and thanks to everyone for joining and for your interest in this area. So as Abby said, so I'm a lawyer by training. I don't actually practice these days, but I'm a lawyer by training. And the idea was that we would complement Dr. Carty's excellent presentation by doing a bit more, a deeper look in terms of some of the technical issues from a purely legal point of view that would perhaps help situate you in terms of how the types of issues that you might have to confront or the Ministry of Health might have to confront and the types of assistance that you could provide in that regard. So, sorry, right. So, you know, the first question maybe about Marissa already kind of answered this question, in fact, but the question is, you know, what does law have to do with it? If we're in a health space, if we're talking about NCDs, isn't that a medical problem? And so if there's not a medical problem, but with persons here being lawyers, it's a little bit more difficult for non-lawyers to get the connection, but we as lawyers all know that there's a legal dimension to everything that happens in life. And so the law is relevant to everything. But I nonetheless like this quote from Jonathan Lieberman. He was speaking in the context of cancer treatment. But it very much speaks to broadly the role that law can play in these spaces, public health, and specifically NCD prevention and control. And so, you know, the idea is, as we would appreciate as lawyers, that the law is a powerful tool as a regulator, as something that allows for the regulation of the environment in which we live. And so he says that law has a particularly powerful role to play in addressing social inequalities, and because of its ability to regulate the environments in which we live, law can modify the structural determinants of social inequities, the causes of the causes, both domestically and internationally. very importantly, he does make the point that law is not the only tool. So he says, however, law is just one of a suite of tools. And that's a consistent message that we try to bring home to persons. So even as we look to explore how law can assist, you also have to be looking to see how the law can marry with the other processes and the other disciplines to sort of give that holistic response. And then he points out that law can also hinder public health objectives. So law can exacerbate social inequalities, for example, through laws that provide for protections of freedom of speech that are extended to corporate expression. For example, that's something we'll talk about, and limiting therefore the restriction of harmful marketing practices, which are often targeted at less advantaged groups. So basically what we're saying is that we have law as a tool and law as a constraint. And basically in this space, what we're hoping to explore is how we can better, and certainly the role that we would hope that the Bar Association would be able to play in support of health policies would be to maximize the function as a tool and kind of guard against the constraints, or try to see what are the exceptions or the ways around some of the constraints, or bear those in mind, certainly as we assist with constructing the policies so that they don't hold us back in the way that the gentleman there is being held back. And so it's also important to recognize, so we're focusing today on SSBs and tobacco control, but very much the NCD space is a continuum in a sense, is a one whole. And so, and you would see many of the risk factors intersect. And so if you have diabetes, that can make your heart disease, that can impact on heart disease, and vice versa. And so similarly, in terms of the law, when we talk about NCDs and the law, it's kind of in a sense almost impossible to be an NCD lawyer, because NCDs implicate so many facets of the law. So my background is trade, and that's where I tend to focus on. But there's been so many other, and human rights, but there's so many other areas, and then you have to reach out and get assistance. And that's where the Bar Association is a great resource, because of course you would have a variety of persons practicing across the gamut. But I mean, just these are the immediate obvious candidates in terms of areas of law that would be implicated by NCD prevention and control measures, and in particular, tobacco control, but until a lesser extent, SSBs, SSB taxation to a lesser extent. So we have constitutional law, we have administrative law when we're looking at the processes for consultations and transparency and sharing of information and all of these things, intellectual property issues as it relates to the use of persons' trademarks and restrictions on those. You have international trade and investment law, raising broader issues of expropriation, discrimination, etc., international human rights. Of course, all the rights are there: right to health, right to food, right to education, right to play, right to development, all of those things. And then you can even have, slightly more technical areas like just standards, right? The regulations that are put in place in terms of what are the standards that you have to meet for X product or Y product. And as you would appreciate, there's a whole process that goes behind that the law is part of or assists with. So, but throughout, even though we have all of these different intersecting areas and potential candidates for assisting with the arguments that one has to make, excuse me, excuse me, really is what is at the core of all the NCD responses, and you would have heard Dr. Carty refer to it there briefly, is human rights. So much of the responses are premised on human rights, and so a lot of the legal arguments start from a human rights base and then take off from there. And the key instrument that we have in that regard is the Convention on the Rights of the Child. I would normally, when I'm presenting on these types of issues, also talk about the International Covenant on Economic, Social, and Cultural Rights, but St. Kitts has not ratified that. There are only 2 CARICOM countries that have not ratified that covenant, St. Lucia and St. Kitts and Nevis. So those obligations do not apply. So they would have to be like maybe more general obligations under the declaration on the UDR, the Universal Declaration on Human Rights. But maybe that might be an area as well for advocacy and on the part of the bar in terms of looking to whether this might not be something that we want to rectify in terms of ensuring that the citizens of St. Kitts and Nevis have access to the international space as it relates to protection for economic, social, and cultural rights, which would include the right to health. But what we do have is, well, what you do have is the Convention on the Rights of the Child. And that's been ratified by every single CARICOM member. Of course, you would appreciate that it's not automatically applicable in a domestic context because of our dualist system. But the fact of the matter is, it's a powerful tool, and we know that we can draw down on internet, even when a treaty hasn't been incorporated into domestic law. We know there are possibilities there to draw on it for interpretive purposes, etc., in terms of looking at legislation and establishing parameters. And so it can still be quite a powerful tool. But once again, that might be another area for advocacy in terms of making sure that the legislation does in fact translate these obligations, that the government does in fact translate these obligations at the domestic level such that they can be acted upon domestically. But basically, when we're in the human rights space, what we're talking about is 3 core obligations that states have. And as I say, much of the legal speak that comes in the context of NCDs is premised on this. The idea that states have to respect human rights, that they have to protect human rights, and that they have to fulfill human rights. And certainly in the NCD space, it tends to be less about the respect, because there's not really that much that the government is doing directly itself that is undermining person's health status. But where we do have much scope for action and discussion and advocacy is in relation to protection and fulfilling. So in terms of protection, you're talking about putting systems in place that prevent third parties from taking actions that would undermine the right to health, for example. And then similarly, in terms of fulfilling, that you're taking concrete steps to put systems in place that allow persons to really enjoy and realize these rights. And so those are 2 very core considerations when you are dealing when you're in the NCD space. Okay, let me speed up. So, okay, quickly now, in terms of the 2 areas we're looking at. So if we turn first to SSB regulation, right? Dr. Carty would have already indicated that they're looking at both taxation, as well as she did have there about regulation of SSBs more broadly. And when we're talking about regulation of SSB, so the taxation is straightforward, as she said. It doesn't really raise any huge legal issues because we know that governments have the power to tax, and so it is just a matter of going through the necessary procedures to pass the legislation. So really, it is the work is more on the side of from an economic point of view, structuring it in a way that is appropriate, etc. And the taxation recommendations are very much premised on the WHO recommendation. So taxation is the best buy. It is a scientifically proven cost-effective measure, particularly when you weigh how much you have to put in for what you get out of it. But then when we think about regulation of the sale and marketing of SSBs, of course, that takes us into a broader legal universe. And so once again, the Convention on the Rights of the Child becomes key, because we're thinking about, well, what are the obligations that are there that are maybe implicated by the state's failure to regulate the school environment? The fact that we know, as Dr. Carty was saying, that our children are drinking 2 and 3 soft drinks on a regular basis. And we know the health impacts that is having. Besides that, besides the convention itself, which of course is hard law, right? We then have so-called soft law. So we have the WHO, UNICEF guidelines, which have been signed off and approved by states, all of our states in the context of the WHO, setting out parameters in terms of how one might go about regulating the school environment. And the idea is that you want to address both the power and the exposure. So you want to limit the marketing and all the posters and those things, but you also want to address the channels by which these things are done, because the two together are what make the whole marketing exercise so powerful. And so the idea is that you would create a space within the school that is like a protected space. And it's not just the school, but the immediate environs as well. And that is also very much driven by, besides the international commitments that we have, at the regional level, our regional health body in CARICOM would have endorsed this approach and basically articulated for CARICOM that this was their plan of action for dealing with the alarming problem of childhood obesity that we have, alarming and growing problem. And coming out of this action plan, CARFA actually identified 6 policies for priority action. These were seen as the policies that could really make a significant impact on the ground. And you know there that we have mandatory nutrition labeling, regulation of the school feeding environment, reduction of marketing of unhealthy foods to children, and then fiscal and trade measures, reformulation, etc. I highlight the ones that I highlighted are the ones that are most topical right now in the region. All right, so in terms of SSB taxation, we do have some experience here in the region. So of course, many of you may know that Barbados, we were the first in the region and one of the first globally as well to introduce an SSB tax. We did it in 2015. It was introduced at 10%, so well below, at half what WHO recommends as the minimum level. That notwithstanding, we did see a decrease in SSB consumption of about 4% and an increase of about 7% in water consumption. But the government has Prime Minister Motley has just announced in her March 14th budget that effective April 1st, we will actually be raising the excise tax up to the 20%. So in terms of, if you're trying to think of concretely what might be some of the legal, because as I said, much of with the taxation, a lot of it is an economic discussion about how you structure it and what tax structures work best, etc. But if you're thinking about legal questions, certainly questions as to definitions, questions as to product coverage, questions as to possible exceptions, those are all questions that basically raise legal issues, because of course we know definitions always matter and those are always legal, right? And the idea is, how do we determine what is an what is a product that should be captured by this tax? And what's the threshold that we use for that? And is that an appropriate threshold? Is this a fair threshold? Is this a rational threshold? Barbados has used its customs headings. So we just use the headings that we use for customs purposes. And to be honest, I think that's a little bit problematic. It could be, we could have a better system, let us put it that way, that is a little bit more formal and evidence-based, but that's the system that we have, and so far so good. We had to do some tinkering with it exactly because Initially, we didn't capture everything that we should have, because just relying on the headings isn't necessarily the best way to go. But those are the types of questions that you can assist with in terms of helping ensure that there's a rational basis, because at the end of the day, one of the things that you will see when it's throughout this presentation is evidence is key, and a rational connection is key. So you want to be able to show that there's a rational and non-discrimination matters. And so you want to be able to say the tax covers X product, but not Y product, because the evidence tells us that this is more of a problem than that is, or this other one isn't a problem at all in the context of the problem we're trying to address. And as Dr. Carty was saying, for example, something like fruit juices, problematic, right? We have fruit juices that have huge amount, can still have a significant amount of sugar in them. We have the fruit juices that haven't added sugar, but then on top of that, you have the ones that don't, but may have very high levels of sugar still. And so you want to be thinking about what is the best threshold or frame of reference to use in terms of determining whether or not a product should be captured. And something like the PAHO nutrient profile, which we've been using in the context of the front of pack labeling work, is perhaps useful, because that gives us a definition of products that are high in sugar. And then we have a clear, objective, evidence-based standard that nobody can then question our motives in relation to or seek to challenge it legally. Then now, in terms of tobacco control, as Dr. Carty would have pointed out, the key document here is the FCTC, which is an international treaty, legally binding. We've all ratified it, so every single CARICOM member is bound by it as a matter of international law, and really is under an obligation to translate it into domestic law so that they can be really implemented and enforced. It's a huge convention, huge, plenty articles. But of the many articles, the Secretariat, because of the challenges of implementation, the Secretariat has identified some priority articles. So kind of like how CARFA did with the 6-point policy package, kind of trying to isolate some core elements, even though everything's important. What if you have to just do a few things for now to start? What should you deal with? What are the ones that give you the most bang for your buck and really transform the environment? And these are the ones, right? So price and tax measures, they recommend that you should be taxing at 75%. None of us are anywhere near there. And then we have these time-bound commitments, which are smoke-free environments. So these should have been implemented within about, I think, if I recall correctly, 5 years of the convention coming into force. So you have smoke-free environments, packaging and labeling, ban on advertising, smoking and sponsorship, and then protection from industry interference. These are the core. So we'll look at a few of these in turn. I keep on moving my cursor from where they. So this is just a quick picture to show you what's the status quo, right? This is taken from HCC's website. So it's not the most up to date, it's just up to September 2019, but you can see all the orange are the areas we haven't done anything, right? So you can see that there's more orange than anything else. And unfortunately, that tends to be the story in CARICOM, as you know, with many of our international obligations. But when it comes to so that's once again, well, you would have heard from Dr. Carty the effort that they're putting in place now to implement those obligations. But one territory that has really done very well recently in terms of making movements in tobacco control and from the sub-region of the OECS is St. Lucia. St. Lucia, and of course, they won the No Tobacco Award from the WHO last year for just this excellent work that they've done in this area. And so I just highlight to you so you get a flavor, a sense of the types of issues that you have to grapple with in dealing with tobacco control and some of the legal issues that might arise. So their smoke-free legislation, which is basically the legislation that says you're not to be smoking in public places. You need to have the big signs up saying no smoking, you know, and the idea is that you're protecting not just the smoker, but also persons from secondhand smoke, because there is no safe level of exposure to tobacco smoke. And so you have there, I copied just these 3 sections to give you a flavor of the legislation. You would see a very broad definition of both tobacco and tobacco product in the definition. And so what that has meant is, because of that it was well drafted, there, even though they did not contemplate e-cigarettes and all the new novel products, because what tobacco does is, as soon as you regulate them in one area, they reinvent themselves. And so St. Lucia certainly has some flexibility there in terms of their legislation being able to speak to a wider range of products that might have normally been the case if they had just said, well, cigarettes, or, you know, or cigarettes and snuff, but had just limited the definition. So definitional issues in terms of tobacco control is quite important, particularly, as I said, because we're seeing a lot of innovation in the space based on the from the tobacco companies. And so you have to make sure that your definitions, your legislation can capture what it needs to capture. And concerningly, we're seeing in the region an increased use of e-cigarettes compared to traditional cigarettes. So we are seeing very much a similar trajectory to what we saw in the US, where the youth are moving away from the traditional tobacco products like cigarettes and more into the vaping and the e-cigarettes, etc. So we want to make sure we capture those types of behaviors and innovations. In terms of what is the core obligation, the obligation is just not to smoke, right? Because we don't want to be exposing persons to the secondhand smoke, and to help the smoker themselves. And so note the wide range of areas where the prohibition operates. So it's a 10-meter radius, within a 10-meter radius of a beach, within a 10-meter radius of a school, of a sport facility, of an outdoor market. So it's really quite a broad and comprehensive coverage there too, in terms of the prohibition. And then you do have the specific obligation in terms of the signs that have to be displayed within your establishment. Now, the other side of tobacco control is, of course, one of the other priority areas was the graphic health warnings. And this is what it is. And I normally use a picture from the Australian one, because Australia actually pioneered this, but St. Lucia has it. So I said, why don't I use my regional picture? So this is actually one of the pictures, an actual picture of what is circulating on the tobacco packages in St. Lucia, right? They have a rotation takes place. So they're like 4 different sets of pictures. This is actually the most graphic. The other ones don't look quite so horrific, but I was choosing it for impact. But what they do is they rotate it, because the idea is that the more you see an image, the more you get desensitized to it. So they rotate it so it continues to have the impact in terms of dissuading persons from from purchasing the cigarettes. And in terms of the types of legal challenges that we've seen in this space, and there have been many, right? We have seen challenges, all of which they've lost. The tobacco companies have lost, I must say that upfront. So we have seen challenges as to unreasonable interference with the display of their trademark, or interfering with their right to property, unduly restricting their enjoyment of their right to property, interfering with their commercial speech. They're not getting to put their message over to the consumer. Expropriation in the context of trade and investment agreements, or just generally that it's just more trade restrictive than necessary. So yes, we understand that you need to regulate this, but you've gone overboard. Now, as I said, all of these challenges pretty much have been lost. So, and the FCTC has been critical to many of those wins in the sense of as a legal instrument, just illustrating the power of law, right, in this space, as a binding legal instrument that is evidence-based, it becomes very difficult to construct counter arguments against the measures that countries are putting in place once they are basing it on the FCTC and the guidelines set out by the FCTC Secretariat in terms of the types of measures that would be a proper implementation of those obligations. But, you know, tobacco will never give up, so they will make the arguments and you just have to be prepared for them. Now, just so speaking of the arguments, I just wanted to quickly, and I'm conscious of the time, I just wanted to quickly take you through concretely in the trade space, what are some of the legal arguments? Because I know some of you may have practices in that space, either trade or investment, as the case may be. And a lot of the legal discussions in this space with these measures tends to go around, revolve around the WTO and investment more broadly. So just quickly, we know that in the context of the World Trade Organization, we all belong to it, we're bound by its rules, it promotes liberal trade. And so many of the measures that you would be seeking to be putting in place in the context of the FCTC would have trade implications. You're putting bans, you're restricting persons' access to products, you're changing how the product can be displayed, all of those sorts of things raise trade issues. And the point to bear in mind is that even though the World Trade Organization is about free trade, it still nonetheless recognizes that there are other values that are equally and in some instances more important than trade, so that trump trade. And so under the GATT, the General Agreement on Tariffs and Trade, you actually have a general exceptions clause that allows for WTO inconsistent action that is necessary for health, once it is not an arbitrary or unjustifiable discrimination or a disguised restriction on international trade. And even though this language is specific to trade and to the WTO in terms of the jurisprudence, when you look at the literature, you would realize it's just a very similar reason. It's just a very obvious legal reasoning in the sense of a sort of proportionality analysis that we would have in a domestic context in determining whether something is reasonable or not. And then you have, besides the General Agreement on Tariffs and Trade, in the news a lot these days in the region has been the agreement on technical barriers to trade, because that deals specifically with that area about the graphic health warnings, because it's a standards issue. And basically, once the standard is implemented domestically, it would be a technical regulation and would fall within the scope of the TBT agreement. But then even at the level of, and of course, we know as lawyers that the specific trumps the general. So the TBT agreement would then be the operative agreement and the GATT would take a back seat. But even in the TBT agreement, we have a provision that pretty much replicates what you have in the GATT context. So it says that it reaffirms that states have the right to implement measures to protect health at the level they choose. They get to choose what is the level of health protection they want. So you can decide that health is super important to you as St. Kitts and Nevis, and that you want the highest standard of when it comes to health protection, and that's fine. So you can do those things, provided they're not an arbitrary or unjustifiable discrimination or disguised restriction on international trade. And as I said, it's very much a sort of a rationality, proportionality type analysis that is specific to WTO, but will be very familiar to you from a domestic context. And then that's in the preamble to the agreement. And then specifically, Article 2 says that technical regulations must not be more trade restrictive than necessary to fulfill a legitimate objective. And one of the stated legitimate objectives is protection of public health. So the idea is that you have this test that you have to meet, that it needs to be no more trade restrictive than necessary for the purposes of securing your public health goal. And once you've ticked that box, you'd be okay. And so this just gives you a little bit more information in terms of the types of considerations that come into play. And as I said, as you look at it, I'm sure it will look very familiar to you. So, you know, is this whole weighing and balancing, you decide how important is the public health goal, and then you look at the damage to the trade, and you look at what alternatives are there, and can the alternative be as effective as what is being challenged? And if not, well, it's safe. If there's something, an alternative that's as effective, then it'll be struck down. And bearing in mind that health is important to the highest degree. So in a sense, the scales start tipped in health favor. And that's from the WTO. Then, but we also had specific, so that's just the language of the agreement, but I wanted to quickly take you through and I'll try to wrap up in like 5 minutes. I wanted to quickly take you through the 2 concrete cases so you could get a flavor of the specific argument. So this was a WTO case that was brought against Australia. A number of territories sued Australia, claiming they were violating WTO rules by implementing plain packaging. Now, plain packaging is a little bit more than graphic health warnings. So the graphic health warnings, just so you're clear, the graphic health warnings is this, the awful picture that turns your stomach. That's the graphic health warning. The plain packaging is this. You realize that you can't see a trademark anywhere, right? And you see that all the pretty images and stuff like that, and the pretty colors and things, they don't have any of that. They did a study and worked out what was the ugliest color in the world to people, what human beings think is and this is the color that persons are most turned off by. And so that's what you have to put your package in. That's the color that it needs to have, and it can't have no big set of decoration and trademarking and all of that, the imaging, no. So that was what was being challenged. And so then, no, I just can skip quickly through here. In terms of the Australia won the case, right? So that's the quick answer to how things worked out. Australia won, it was appealed, and Australia won again. So it is very clear that in the context of the WTO, not just graphic health warnings, but an even further step of plain packaging is WTO consistent from a legal perspective. And so, and the appellate body in reaching its determination very much did the weighing and balancing analysis that we spoke about, right? They looked at the contribution that these measures made to the public health goal of helping reduce tobacco control and self-consumption. And Australia had significant numbers, right? Looked at its impact on trade, and then you look at the risks associated and what risks in particular of non-fulfillment. If you don't do it, what will happen? And the scales tipped in the favor of health, right? It was seen as a rational, reasonable measure, something that was rationally connected to the goal, was supported, wasn't arbitrary, was supported by evidence, was a legitimate objective, and therefore you tick the box. And yeah, all of this. And what was key as well, and that's something that you can bear in mind as attorneys, is that the secretariat, so you would have heard Dr. Carty talking a lot about PAHO. PAHO is helping with this, and the FCTC secretariat and WHO were critical to all the litigation in these processes. They functioned as amicus, and because of their technical expertise, the panels were strongly influenced by all the evidence they led. So any WHO report, any, you know, all the studies they had done, and just their testimony itself, because in some instances you didn't have the science there, to the evidence to back up some of the expectations. We're still working it out. We're going to see what's going to happen in 5 years' time. But as an expert in the field, I anticipate that we will continue on this trajectory. And they were very influential in that regard. The other aspect that was also addressed was intellectual property. Don't know, a lot of you may have intellectual property practices. And this was, they argued in this case, well, not so much Philip Morris, it was the particular countries, but we know the tobacco companies were behind the claim. They said that the plain packaging was an infringement of trademark. And that was an important claim that they were making, because basically it went to the nature of trademarks. And what they were saying is that a trademark is a positive right, not a negative right. So it creates a positive right for me to be able to display that trademark. And so to the extent that the plain packaging was reducing the trademark down to this small part of the box, it meant that they had infringed the intellectual property of the tobacco companies. And equally, they argued that the plain packaging was an unjustifiable encumbrance on this right to property that they had in the trademark. Was all rejected. The committee, the appellate body upheld that intellectual property rights are negative rights, not positive rights. So you get to prevent others from using your mark, but it doesn't create an obligation that you must be able, a right, an entitlement to display the mark yourself. And so this is just a quick checklist that one can bear in mind, and if you're helping the Ministry of Health, etc., in terms of the types of considerations that you want to bear in mind to make sure that you insulate your legislation, your policy as much as possible from challenge. Now, it's not to say that anything is going to be foolproof, because the tobacco industry is such, the big food is such, that they always try to use those threatening tactics of litigation in the hope that it causes people to pull back, even when they know that they're not going to win. As I said, they've been losing all of these cases, but that doesn't stop them from trying to make the argument. And that's why it's so important that as lawyers, then you are able to engage with them in an informed way to say, but no, that's not the situation, etc. And that's exactly what Australia did, right? Australia had lawyers, and that's something that I say to people all the time. And so it's so commendable that the Ministry of Health wants to involve the bar, because so often, as we know, people involve lawyers when they have the dispute. That's not the time to involve the lawyer. The time to involve the lawyer is at the beginning, when you are starting out with the enterprise. You have the lawyer involved from the get-go. And then if there's trouble down the road, then you're able to better anticipate, well, we're going to win because we had considered all of these things back up when we were drafting it. And that's exactly what Australia did. So when the tobacco industry said to them, if you pass this plain packaging legislation, we are going to sue you. They said, bring it on. Bring it on, because we know we will win, because we have sat down and done the analysis. Well, you know, never 100%. You never know what's going to happen in court on the day, but we are reasonably confident that we will win, that the evidence and the law is on our side. The other one that I have quickly just highlighted to you, and I'll share these slides because I'm conscious of the time, so I don't want to go on much longer. This is just more of the same. This was a bilateral investment treaty. Now it was Uruguay. They had implemented tobacco control measures. So a single presentation requirement. So you were able to have, you know, you can have variations of the same brand, and they marketed to different sectors of the public. Well, they didn't allow that. You could only have one presentation. And then they increased the graphic health warning to 80% of the package. So it meant that only 20% was available for display of trademark, etc. Had the same Same sort of arguments. They said impairment of the use and enjoyment of the investment under the investment treaty, a breach of fair and equitable treatment and denial of justice, expropriation of their property, and failure to observe commitments. Basically lost on every single thing. On the two key ones being the fair and equitable treatment and expropriation. They said fair and equitable treatment, there was no arbitrariness to these regulations. They were based on sound science. They were based on the FCTC. They were based on the guidelines coming out of the FCTC. And so there wasn't any sense in which you could say that these were arbitrary or unreasonable. And therefore, in that context, they didn't breach the fair and equitable treatment standard. And on expropriation, they said expropriation doesn't apply when the government exercises police powers, that the government has the right to regulate in the public interest for health, and those circumstances are not considered expropriation. So they lost there as well. So this is the last slide. The question is, the future battleground. So we're quite clear on where we stand with tobacco. The one that is a little bit more troubling or question marks is the food space, including the SSBs. So you do have the border issues, and this is the front of part warning labels that we want to have as a regional standard that industry is fighting us on. St. Kitts actually abstained when the vote went to cross-Q. Barbados voted in favor. St. Lucia voted in favor of adopting these as a regional standard. So these are based on the macronutrient profile, and they indicate to you products high in salt, fat, and sugar. So the little octagonal warning signs say high in sugar, high in salt, high in fat. And the idea is if you go in the supermarket and you see this, you know immediately that that's something that's not really good for you. And you don't need to be sitting down and have a degree in that, be a dietitian and doing all the calculations. And so these types of measures, which will go along with the whole idea of regulating the school environment and regulating the marketing and sale of SSBs, but also other products, will potentially raise a huge host of issues about the right to health, but also freedom of expression, both in terms of individuals' right to access information, accurate, conflict of interest-free information, as consumers, but also to then the businesses' right to commercial speech. And how do we strike the balance there in the content? And that's a pure constitutional law issue, right? That's not an international law issue. That's a domestic issue. Then you have right to property issues. Are these undue encumbrances on your enjoyment of your right to property? There are due process issues, access to information. Right, I forgot, I was checking, somebody can remind me, I think St. Kitts has a Freedom of Information Act. Barbados doesn't, but I think St. Kitts does. So those pieces of legislation, for example, become very important in terms of making sure that there was due process and that information, that nothing untoward was happening in terms of influencing outcomes, etc. And well, I have right to health twice, but I have here it is that you can maybe get at the right to health, saying that certainly not St. Kitts and not Barbados don't have a right to health written into our constitutional text. You might maybe be able to get to those two a more indirect route, to the right to life, to the right to protection of the law. There've been some interesting decisions of the CCJ. Of course, Barbados has the CCJ as its final court of appeal. So the recent CCJ decisions open interesting possibilities about how we might read some of our existing rights in a more liberal and a liberal way, to a creative way to maybe address some of these issues. And that's it. Thank you very much. I went way over the time that I intended, but I wanted to make sure to cover all the bases of giving you some of the concrete examples of what would happen. So I'm happy to entertain any questions. And I've said to Abby, I'm more than happy. I have a reading list. I'm actually teaching a course right now, a short course right now on NCDs and the law. And I just prepared the reason list for the topic of interrelated regimes, which is, you know, trade, intellectual property, and investment, as well as human rights. So I was saying to her, if the bar was interested, we'd be happy to, the Law and Health Research Unit would be happy to share that reading list with you, so that persons could always investigate the information further at their leisure. I have a list of the cases and the, you know, the arbitral awards, etc., that you'd be able to do a deep dive into the reasoning, etc. So that's it. Thanks very much.
Wonderful. Thank you so much, Nicole, for that very comprehensive presentation. I'm sure everybody found that to be very informative and useful. So now I'm going to hand over to Iseline Phillip, who is our Advocacy and Research Officer, and she's going to lead or facilitate a discussion and Q&A. So just to say that if you have any questions for either Dr. Carty or Nicole Foster, feel free to put your question in the chat box, or if you actually want to speak, let us know, raise your hand. You should be able to use the raise your hand feature, which is under reactions at the bottom of your screen, and then we can unmute you. So what we've done is we've muted everyone just to prevent disruption to the speakers while they were speaking, but we can unmute you if you'd actually like to speak. So over to you, Iseline.
Okay, thank you, Abby. Good night to everyone. And thank you to Dr. Carty and as well Dr. Foster for your presentation. I think it was very informative. I learned quite a bit, so I don't have a legal background, but I do work in policy development, so I understand the implications of having to develop policy based on the law. So I'm actually very interested in finding out what you as all legal experts and persons working within this field are interested in knowing more about, and if you have any questions in relation to the presentations, or any questions for Dr. Carty herself, since she's working in the ministry very diligently to actually push forward and develop these policies for implementation. So again, just kind of to reiterate what Abby said, if you have a question, you can type it in the chat box, or you can raise your hand. I guess I'll ask Abby if she can kind of help me monitor if anybody raises their hand. And so we can unmute you and you can ask your question verbally if you'd like to. But if I don't see anything currently, I have some questions to start facilitating the discussion, because I did find it quite interesting. And I kind of guess I want to start a little bit. So Dr. Foster, you did mention one of the strong points in terms of the cases that we
You're
had.
promoting me. I'm not Dr. Foster. I'm just.
Oh, you know what? Oh, sorry. Okay, so Ms. Foster, Professor Foster, is that okay if I call you Professor then? So one of the things that you mentioned just in terms of one of the strengths when it came to a number of these cases around the Tobacco Control Act, as well as different policies in regards to health, was the involvement of lawyers at the start of the process. And I just kind of want to let this be an opportunity, because one of the reasons, Lake Health and Wellbeing, we facilitated this collaboration and this legal education session is so that we can try to initiate that relationship. And so I actually want to give Dr. Carty an opportunity at this time to kind of express, what she would like to see, as, at the NCD program coordinator, and how she would like to see the Bar Association or more lawyers engaged in the policy development process when it comes to health policy. And just to kind of put that out there so that, the 100 lawyers that are on this call, if there's anybody, so that they can know that what the need is. So what is the need in the Ministry of Health? And so just kind of Dr. Carty, over to you to let us know how you would like to be able to engage with lawyers of the Bar Association more in regards to health policy development. And we'll just kind of start with that question. You're on mute, Dr. Carty.
Sorry about that. Thank you, Iseline, for that question. Basically, what we would need from the Bar Association would be support in terms of, even if we can have 1 or 2 lawyers who would be willing to sit with the policymakers within the Ministry of Health to discuss exactly how we can go about making sure that our policies are, number one, in line with those conventions that we have signed on to. So we might have the convention format, for example, like the WHO FCTC. But when we are actually working on putting the legislation or the policy together, we may not be taking certain aspects into consideration that we should. But because lawyers are the ones who would have a better mindset as to these treaties and how they should be looked at and discussed and so forth, then they can share that expertise with us. Additionally, I'm not too sure if we have any of our lawyers from the legal department of the government here with us, but one of the things that we are also looking for is a focal point that can be assigned to the Ministry of Health so that that person can be easily called upon when we are having issues with our development, can share the problems or the challenges we are having, and have that one-on-one conversation with the lawyer or the drafter, so that whatever we come up with would not be just from the Ministry of Health going down to the legal office, but would have already had that support and that collaboration with the legal office in order for us to make sure that whatever we develop would be as strong as it can be.
Dr.
Great.
Carty, I wanted to ask a quick question. Just following on from what you were speaking about there, do you all have, I don't think your NCD commission is still functioning?
No, and that's
Right.
One of the
because
things
what I was
started-
thinking was, is that a useful way, so St. Lucia, right now their NCD commission, the mandate has run out. So unless they, they would now have to redo that mandate, restart that mandate again. But fortunately, when they were working on the legislation, the NCD commission was still operative. And so what I was thinking is that really the best sort of structure for the type of support that you want would be something, so the bar would be able to very easily like have somebody who sits on the NCD commission. You understand what I mean?
Yes,
and then
definitely.
that person de facto is like a focal point, because they would be there for the NCD commission meetings. They would be able to be contributing their legal perspectives. So that might be something to consider too, in terms of if it is possible to get your NCD commission regenerated, because then that gives, as I said, good structure, but also legitimacy. So it doesn't seem like this ad hoc, informal something. Is something structured and formal, and then the bar is able to see clearly where they will fit in and what functions that they would have to play. That's just my initial reaction. Of course, the bar persons are on the call, they will speak for themselves. But that, when you were speaking, I was saying something like an NCD commission would be a great space for that to happen, because you would sort of kill two birds with one stone. They would be there, but then they would also be de facto your focal point, because then when you're not at NCD meetings, the person who you're going to call and speak to is the person who you normally have the meeting with at the NCD commission, right? And so, whether they signed up for the role or not, de facto they will be the focal point. And then you have that nice synergy, that alignment and interlinking of what's happening in the NCD space and then what's happening in the thing. So that might be something. I know the NCD commissions have been a challenge across that institutional thing has been, as I said, St. Lucia's isn't functioning right now either. And that's one of the challenges that we've experienced, that really you do need those commissions functioning effectively to really leverage the expertise that you have out there to get the best out of it. Yeah.
From the Ministry of Health perspective, we have been trying to work on reestablishing the NCD commission. We have at least on 2 occasions came up with a list of individuals who we would have, considered to be to sit on that commission, but we have not yet been able to move forward with it. So that is definitely something that we can put in place in order to make sure we get that support in that way. Yes.
Okay, great. So we have like potential calls or lawyers on the line to be a part of the NCD the NCD commission that is to be established here in St. Kitts and Nevis. And of course, as Dr. Carty mentioned, just the level of support that they'll be looking for in terms of just having a focal point, either in the legal office from the government, or also just from lawyers. If I don't know if you guys do like volunteer work in terms of legal expertise. I don't know what the framework is for the Bar Association, but I think in aligning with the mandates of the association, from what I understand the president, Mr. Wilkin mentioned, you know, to be able to offer the kind of legal perspective and support to determine, you know, whether the laws are actually adhering and meeting the needs of the persons in the Federation. So I'm gonna go into a couple of legal questions. I'm still kind of looking and not seeing any questions in the chat, but we have some commendations. Everybody's saying excellent presentations to both our speakers and presenters this evening. So thank you for that. And of course, any questions, feel free to add to the chat or raise your hand. So question I have kind of legally. So Professor Foster, you mentioned about, you know, when it comes to thinking about things like SSB taxation, the legal questions around that are really things around definition and coverage. You know, like so one definition you're talking about, well, what's considered a sugar-sweetened beverage, and kind of the way to make sure that that's reasonable and rational. You highlight the PAHO nutrient profile, which actually has actual calculation as to what is considered too much sugar or high amounts of sugar versus a reasonable amount based on, I think, World Health Organization standards. But we didn't say much about when it comes to the bans and restrictions. So what types of legal questions are we actually thinking about or considering that when we talk about if we want to restrict the sale or ban the sale of these things in and around schools? What are the legal implications, especially if we're talking about it in relation to, you know, protecting the rights of child and, you know, health being one of those rights? I believe health is actually explicitly mentioned in the Convention on the Rights of the Child. So what are some of those?
So all of those issues are really going to boil down to questions of proportionality. If we're talking about a ban, so recognize that regulating something, restricting how much of something, and banning it is a more extreme response, right? So the idea would be, as I said, it's the same sort of analysis that you have in the WTO specific context, but now more generalized. So the idea is, in the universe of possibilities, of possible responses, is this the best response? Is this the most proportionate response? Is this the response that is rational? Is this the response that says to us that, yes, I will achieve this goal the best this way, right? Now, when it comes to children, in the same way that you see in the WTO, I was saying you start off kind of tipped in favor of health because they recognize that health is a value that's important to the highest degree. So yeah, at least equal, if not a little bit above trade when you're starting off. And then you have to weigh a balanced stuff and see where you end up. So you're going to tend to always be that health is a little bit tipped. So in the same way, when it comes to children, because, you know, we have to factor in that children are vulnerable. Children are, you know, need to be protected. We have obligations to them, as you said, more broadly in terms of their human rights and just securing their well-being. And so the proportionality analysis would have to take account of who you're dealing with. So a ban might be seen as a disproportionate response in the context of the broader society. Let us say that, if you just wanted St. Kitts and Nevis will just not have SSBs at all, ever. You know, nobody is to have access to SSBs. Then, you know, they're gonna say, but they have, you know, people have a right of choice. They have, you know, they're rational human beings. You get to make choices about how you want to live your life and whatever, right? But that becomes a very different calculation. Like I said, once you put children in the mix. So what you would tend to find is that the courts, and there've been some decisions in the tobacco space where, you know, a broad ban for tobacco stuff might have been problematic, but then when it was put in the context of dealing specifically with children or environments where children predominated, then the balance went in favor of the regulation because you recognize that is a slightly different subject that you're dealing with here. So children by their nature are vulnerable and we have an obligation to protect them. And so the courts would be more likely to accept more extreme actions than they would in the context of the border society. And so that's what that's how you would have to, but it's not, you know, the point is that none of these things is kind of like how I was saying with Australia, right? And the plain packaging. You can do the analysis, and the lawyers on the call will know, you can do the analysis all you want, but you don't know until you go into court and the judge rules, right? You can never be 100%. So, but basically in terms of, as I said, in terms of the precedents that we have, it would tend to suggest that the proportionality analysis would be influenced by the fact that it's a child involved, and therefore they would have more of a tendency to want to protect the child from harm than in other circumstances where you might say like an adult, well, that's a choice they can make, and you know, we leave them to make that choice. Yeah.
So are you aware of any instances where there have been any cases around resistance to those bans? So I believe Trinidad and Tobago actually cabinet passed the law.
So in our region, we haven't had any litigation. So the closest we would come to litigation in the region is when Jamaica, it was in the context of tobacco, not food. And it was when Jamaica was implementing their FCTC obligations, the plain the graphic health warnings. And they had their graphic health warnings were at 60% of the package. The minimum is 50, they put it at 60. And, you know, the regulations along that. And the tobacco industry came back, pushed back really strong and made a lot of threats and told them they would sue them, that they were violating this, that, you know, everything they could think of that they were violating. And the Jamaican government actually adjusted their regulations. So it's down to 50 now. It's not at the 60 that it used to be at. But what they had to do was to reach out to civil society, kind of, because then they were scared that, you know, civil society more broadly was scared that maybe Jamaica wouldn't implement at all, not just, you know, make a little adjustment, that they would just pull this legislation. And so they rallied strongly behind the government, civil society in the Jamaica Heart Foundation, etc. And what they were able to do is to leverage contacts within the broader international community to say, look, you know, draw down on all the resources, get the legal advice, get the sort of a thing. And similarly, like the Uruguay, so you know, the threat of litigation is a real threat, and it is a serious threat. And certainly for small states such as ours, it would be a very serious threat because international litigation is very expensive. Litigating domestically is expensive. For the less, you know, if they're taking you to WTO or under some investment treaty or something like that. Australia had this case in the WTO, but tobacco had also sued them in multiple other fora. So they had sued them under a bilateral investment treaty that they had. They sold them domestically as well. And the investment treaty one that they had, I didn't highlight that in this presentation, but the investment treaty version of the challenge that they had cost them $39 million to defend. $39 million is not a, you know, drop in the bucket. I don't think any of our governments would you know, be able to say, oh yeah, that's all right, we got that money. So, you know, it is a real, that is an issue. And that's why I say, you know, you kind of have to do your homework beforehand so that you have a level of confidence. So not necessarily that you're going to litigate, but that you're able to engage with the other side and say, no, this is our position, the XYZ, and be able to put your case, you know. Now, it may not be that we're able to run it all the way to litigation because we might work out that the cost is just too much or whatever it is. But the fact of the matter is that, you know, industry so often expects that, you know, they're going to say boo and we're just going to run. because we are never able to engage them on these issues, which is why it's so important to build the capacity. Because when you're able to counter, I mean, we saw it, for example, with front of part warning labels. That whole campaign, I mean, industry, I personally believe was taken off guard. They were accustomed that when they came with all of these bogus arguments, you know, civil society would just continue to say, no, 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 but health is important, or, you know, but they never expected, you know, somebody like me to be able to engage with them on what WTO rules require or not require. And then we had economist people and on whatever. So you need to be able to engage. It may not be that you're able to take it all the way, as I said, because the cost of litigation might just be too prohibitive that you just think that I can't take it all the way of, you know, holding from. But the chances are that once you counter, then they realize they can't win with that argument, because no, you know what you're talking about. I mean, I remember I used to be a diplomat. And so I was in the WTO. I used to represent Barbados, and I remember, you know, you would hear when we were dealing with the whole issue of public health and intellectual property, and you would hear the ridiculous arguments that drug companies would, you know, when they're visiting domestically territories, they would be telling them, oh, if you have a patent in the US, you have to respect it here. And patents are territorial, you know. But because you didn't know, you know, because they're speaking to ministries of health don't necessarily know anything about intellectual property, you know, and so they're accustomed to getting away with that sort of stuff.
Well, we do have one question. I'll probably take this as, and then we wrap up. So this question, we thank you for the question, Carlston. This question is for Dr. Carty. And, you know, like, I think, you know, we've heard about all the precedents we have. So the question for Dr. Carty is, would the implementation of these legislations as it pertains to tobacco control and sugar sweetened beverages be considered as an intervention for primary health care? So would these policies, these laws be considered an intervention for primary health care? You're on mute, Dr. Carty, you're on mute, you're on mute.
Sorry. I was saying, thank you so much, Mr. Adams, for your question. And the short answer is yes. These interventions are considered part of primary health care because they affect the persons at an individual level. So even before they have to see a primary care provider, they can make these behavioral changes based on the impact that these legislations and policies would have that can help to prevent them from reaching their primary health care provider. But that's not to say that persons who have already been diagnosed with a condition or may have already had to experience some sort of secondary health care cannot also benefit from these interventions as well. But they are specific to the primary health care perspective, yes.
Okay. Well, thank you. I think we're going to wrap up now. I know, you know, lawyers have very long days, but, you know, we are grateful for the attendance. We had up to 100 participants, and especially want to thank, you know, Nicole and Dr. Carty. Obviously, there's clearly precedent for these law and policy, health policy interventions. So I'm grateful for the information. I've certainly learned a lot. So, and hopefully a call for, you know, lawyers to connect more with the Bar Association, we can see, and hopefully facilitate some more of these engagements in the future. For now, I'll turn over to Ms. Rhonda Nisbett-Browne, who actually taught me law in CFBC. She will do the vote of thanks right now for the evening. So thank you all. That's it for me.
Yes, thank you so much, Iselene. For a moment there, I thought I did have to carry out my tasks again this evening. And you know what? I can just simply thank you then. But I certainly would like to wrap up this evening's exciting and informative session by thanking, of course, the Lake Health and Wellbeing organization, the organizers and sponsors of this evening's event. A hearty thank you to Dr. Marissa Carty, our first presenter, and she's the NCD program coordinator at the Ministry of Health for St. Kitts and Nevis. I especially took note of the statistics that you presented, Dr. Carty, on the 68% increase in death as a result of NCD. I think it was 68% in 2019. So it shows that we have a serious issue here in St. Kitts and Nevis that we would need to tackle. I also wish to thank you, Professor Nicole Foster. I can see that you certainly have a lot of passion for your work and for what you do, because you certainly enjoyed your presentation and the question and answer segment as well. I wish to thank you for your statistics, the statistics you provided on Barbados and its 4% decrease in SSB consumption, with a 7% increase in water consumption. So that is really a positive step in the right direction. And I hope we here in the Federation can catch up as well. A special thank you to the session chair, Abby Begho. I hope I have that pronunciation correct. Forgive me if I don't. But I wish to thank you for so ably chairing this informative session this evening. Iselene Phillip, it's so lovely seeing you in this capacity. Yes, my little student is all grown now. Thank you for facilitating the question and answer segment, and I wish you continued success in your career. Of course, a big thank you to the St. Kitts and Nevis Bar Association for its partnership, its promotion and its participation. To Garth Wilkin, our president, a special thank you for providing your opening remarks. Of course, I would wish to thank all of the attendees. I think at my last count, I saw 100 persons log on. So this is great indication of the interest in this area. And I certainly would wish to encourage future collaborations with the Lake Health and Wellbeing. I heard about a special NCD commission. Some of my colleagues I see on the Zoom, and perhaps you may hear from some of us. You asked Iselene about our pro bono work. We do a lot of that, and I'm sure some of those persons would be happy to reach out to yourself, Dr. Carty and Professor Foster, and indicate an interest. And so I would wish to thank everyone for attending. I would wish to wish everyone a great good night. For those of you who may be traveling shortly, like myself, I do hope that you arrive to your destination safely. All the best, and thank you for including the St. Kitts and Nevis Bar Association in your educational training.
Thank you for having me.
Thank you. Yeah.
Thank you very much.
Thank you all.
Okay, bye all, have a great night. And remember, as I said, I can make the resources available, the reading list, etc. available if persons are interested to do further reading.
Yes, thank you.
Thank you.
Thanks to one and all. Good night.
Bye-bye.
Bless.